You rarely hear anyone celebrate their kidneys. They don't thump like a heart or glow like skin. They just work, hour after hour, quietly filtering your blood so the rest of you can live. That quiet is why so many people discover kidney trouble late. When harm begins, there's no siren. There's a whisper. Shoes feel tighter at night. Your ring leaves a mark. Blood pressure creeps up for no reason. Nighttime bathroom visits multiply. Then a routine test mentions protein in the urine or a lower filtration number, and it feels like the ground shifted without warning. The title of this video says a kidney doctor is warning you about the worst poison. I'm not your doctor, I'm your guide. My job is to translate what nephrologists teach into a plan you can actually live with. And the warning is simple. For most older adults, the worst poison for your kidneys isn't a liquid in a bottle. It's relentless pressure. Chronically high blood pressure acts like sandpaper across millions of microscopic filters inside your kidneys. Day after day, year after year, that pressure scuffs, scars, and stiffens tissue that was meant to be delicate and responsive. If we calm the pressure, we give those filters a fighting chance. If we stack that with a few precise choices about salt, medicines, hydration, and sick day rules, we can slow or even stop the slide. That is what this video is about. Not fear, not guilt, but a practical blueprint to neutralize the poison that most often steals kidney health after 60. To understand why pressure is so destructive, picture each kidney as a small city of filters. Inside are about 1 million tiny knots of capillaries called glomeruli, each like a ball of yarn made of microscopic vessels. Blood arrives, pressure pushes fluid through that yarn, and then a long, elegant system reabsorbs what you need and lets waste drift away. Healthy kidneys live in a narrow Goldilocks zone. Not too much pressure, not too little. When the force is high all the time, the yarn thickens and hardens. The filter leaks protein that should stay in your bloodstream. Doctors call that albuminuria, and it's one of the first whispers that pressure has been acting like a toxin. If the leak continues and the scarring grows, your filtration number, the eGFR you see on your labs, slowly falls. That number isn't your destiny, but it is a trend line that asks for action. What makes this tricky is that high pressure doesn't hurt like a cut. You don't feel scarring as it starts. You only feel the consequences months or years later as swelling, fatigue, higher readings on your home cuff, or a call from your clinic. The poison here is not dramatic. It's daily. After 60, several ordinary patterns push pressure upward. Arteries naturally stiffen with age. The reflexes that fine-tune blood pressure become a bit sluggish. Many of us sleep less deeply than we once did and hold tension longer during the day. Salt sensitivity increases, which means the same pinch you used to sprinkle on dinner pushes your numbers up higher and longer than it used to. Some everyday pain pills make the body retain salt and water and clamp tiny kidney vessels. A habit of light breakfasts and heavy evening meals raises both pressure and nighttime bathroom trips. And a quiet partner that often rides with pressure, especially in modern life, is uncontrolled blood sugar. When sugar runs high, it inflames the same filters pressure is sandpapering. If pressure is the flame, sugar is the accelerant. The good news is that both respond to signals you control. They are not a verdict. They are a pattern, and patterns can change. Start with a small lever that sends an outsized signal to your blood vessels. Steady, short, isometric holds. You don't need equipment, and you don't need to become a gym person. 3 or 4 days a week, take 7 to 10 minutes in your living room. Stand with your back against a wall and slide down just enough to feel your thighs working, as if you're sitting in a high chair. Keep breathing. Never hold your breath. Hold for 45 to 90 seconds if you're new. As you adapt, you can stretch toward 2 minutes. Rest for a minute or two while you stroll around the room. Then sit tall and squeeze a soft ball or rolled towel in your right hand at a steady, moderate effort for 45 to 90 seconds. Rest. Switch hands. Finish with a second wall sit. The effort you feel is in your legs and forearms, but the training target is your vessels and the reflexes that regulate them. Each hold is a lesson. Contract, breathe, release, recover. Repeated a few times a week, those lessons often nudge resting pressure down within weeks. Lower resting pressure means less sandpaper on your filters. It's a tiny routine with big consequences for kidneys. Next, make peace with flavor while getting serious about sodium. This isn't about eating joyless food. It's about steering the chemistry your kidneys live in. After 60, many people become more salt sensitive. The same amount of sodium raises pressure more than it did at 30. The largest sodium sources in most diets aren't the shaker. They're bread, deli meats, canned soups, sauces, restaurant meals, and healthy snacks that hide salt in plain sight. Shift flavor toward herbs, citrus, garlic, pepper, vinegars, and spices. Read labels. Choose low-sodium versions of staples and taste your food before you salt. If your kidney function and medications allow it, and only if your clinician agrees, replacing some table salt at home with a potassium-enriched salt substitute can push pressure down an extra few points. That swap is powerful and not for everyone. If you have advanced kidney disease or take medications that raise potassium, skip it. Safety first. The principle stands regardless. Build flavor without reflex sodium. Build your day around a calm plate that keeps sugar and pressure steady. Your kidneys hate extremes. Start mornings with protein-centered meals that don't spike glucose or load you with sodium. Greek or soy yogurt with berries and nuts. A vegetable omelet with a slice of whole grain toast. Tofu scramble with tomatoes and spinach. Oats cooked in milk or soy milk with a scoop of protein and a sprinkle of seeds. At lunch and dinner, let vegetables and beans take up half the plate. Add a palm-sized portion of protein you enjoy. Fish, poultry, tofu, tempeh, or a modest serving of lean meat. And keep starches in reasonable portions, favoring intact grains over refined ones. If your clinician has asked you to limit potassium or phosphorus because your kidney disease is more advanced, follow those instructions. The same framework still applies, just with tailored choices. A calm plate lowers spikes in sugar, quiets insulin, and makes pressure easier to control, which is the entire point. Your kidneys aren't grading your food by cuisine. They care about the chemistry they bathe in all day. Because pressure is sneaky, measuring makes the invisible visible. Get a validated upper arm home cuff. Check your numbers in a calm moment, seated, back supported, feet flat, arm at heart level. No conversation, no caffeine or exercise for 30 minutes prior. 2 readings, 1 minute apart, averaged. Jot them down. Do this a few days a week at roughly the same time. Don't chase any single number. Watch the trend over weeks. Bring that log to your appointments. It's a window into how your kidneys are living between visits. Knowing your true at-home pattern prevents overreaction to one clinic reading and helps your team adjust medications in a way that protects your filters while preserving your quality of life. Medicines matter. Not just which ones, but how you take them. If you've been prescribed a blood pressure medication or a kidney protective diabetes medication, the best time to take it is the time you never miss. The perfect hour you forget is worse than the good hour you keep forever. If your urine tests show protein leaking, ask whether an ACE inhibitor or ARB is appropriate, and how to monitor potassium and kidney numbers when starting or adjusting it. These medicines don't just lower pressure, they change signaling inside the filters to reduce scarring. If you live with type 2 diabetes, ask plainly whether a kidney protective option is part of your plan. A few modern choices improve kidney outcomes beyond their glucose effect. If you take a daily baby aspirin because your clinician asked you to after a heart procedure, ask your pharmacist about timing relative to any occasional pain medicines so you don't blunt aspirin's heart protection by accident. The thread tying all this together is precision. Medicines can be allies for kidneys. They can also collide in ways that create unnecessary risk if we take them without a plan. On the topic of pain medicines, treat non-aspirin anti-inflammatories with the respect they deserve. Pills like ibuprofen, naproxen, diclofenac, and some prescription cousins can be very helpful for short flares, but they also tighten blood vessels feeding the kidney filter and make your body retain salt and water. Pressure climbs. For someone already taking a water pill and an ACE inhibitor or ARB, Adding an oral NSAID layers risk on top of risk. If you can, make topical anti-inflammatory gel your first choice for joints close to the skin. Hands, knees, ankles. You get local relief with much lower bloodstream exposure. Use heat to start the day, ice after activity, and a simple strengthening plan so the joint is held by muscle, not wishful thinking. If you truly need an oral NSAID, use the lowest effective dose for the shortest possible time, and tell your clinician so they can help you avoid dangerous combinations. This isn't about never touching a pill. It's about not inadvertently throwing gasoline on the very fire we're trying to cool for your kidneys. Make sick day rules part of your life before you need them. When you get a stomach bug, heat illness, or flu with vomiting, diarrhea, or very poor intake, your blood volume shrinks. Kidneys receive less flow. The medication combination that is safe on a normal day can pinch too hard during dehydration. Many clinics give patients a sick day list, medicines to pause temporarily until you're drinking and eating normally again. Commonly certain blood pressure drugs, diuretics, metformin, and NSAIDs. You don't invent this list on the fly when you feel miserable. You agree on it in advance with your team and keep it where you can find it. That single step has prevented so many hospital visits that it should be as routine as keeping a thermometer in the bathroom. Sleep and stress are not side quests. They are direct lines to pressure. Loud snoring, witnessed pauses in breathing, or waking unrefreshed with morning headaches can signal sleep apnea, which drives pressure up at night and keeps it up during the day. Treating it helps hearts and kidneys. Chronic stress keeps your nervous system in on mode. A few minutes a day of slow, comfortable breathing, about 6 breaths per minute for 5 minutes, pushes the balance toward calm, and that shift shows up on your cuff. Tiny habits change the chemistry your kidneys live in all night and all day. Hydration asks for balance. Flooding your body with gallons of water won't flush toxins and can be dangerous if your kidneys already struggle. Too little fluid, especially in hot weather or when ill, pinches your kidneys. What most people need is regular, sensible hydration spread through the day, more on hot or active days, less late at night, if bathroom trips steal your sleep. Pale yellow urine is a decent guide unless your clinician gave you a specific limit. Respect any fluid targets you've been given. They exist to keep you in the zone your kidneys can thrive in. Coordination protects you during scans and procedures. Contrast used for some imaging is safer than it once was, especially with modern protocols and proper hydration. But if your filtration is borderline, your kidney team and imaging team should talk before and after. Ask what steps they'll take to protect you, whether you should pause any meds, and how they'll recheck labs. This is not about fear. It's about making sure everyone rowing your boat is rowing in the same direction on the same day. Supplements and herbs deserve a clear word. The word natural is not a safety certificate. Some products have injured kidneys, either because of the plant itself or because of contamination with heavy metals. If a tea or capsule promises to cleanse your kidneys, ask a simple question. Does it lower urine protein or stabilize filtration in high-quality studies? If the answer is silence, step away. The best cleanse for kidneys is quiet pressure, steady sugar, sensible salt, safe pain plans, and a life that avoids extremes. Because stories make blueprints real, imagine 3 lives. First, Raymond, 68, proud of being tough. He salts generously, takes ibuprofen for his back most days, and makes only 1 cup of water last an afternoon because he hates peeing. He doesn't own a cuff. One July, he gardens all day, barely drinks, swallows a few extra pills, and feels dizzy. In the emergency department, he learns he had an acute kidney injury. He recovers most of the way, but his filtration never returns exactly to where it was. He calls it bad luck. It wasn't luck. It was physics. When he decides he's tired of fear, he does not become a monk. He buys a validated cuff and checks calmly 3 mornings a week. He learns the wall sit routine and pairs it with hand squeezes. He moves flavor toward herbs and citrus and away from automatic salt. With his clinicians okay, he keeps topical gel on hand and sets a firm cap on NSAID pills for flares. He prints his sick day rules and tapes them inside a cabinet. 6 months later, His evening swelling is gone. His readings live a little lower, and his labs stop sliding. He smiles because the plan felt small. The results did not. Second, Lila, 71, a cook who loves feeding people. She skipped breakfast for years because that's how you lose weight, then crashed mid-morning and grabbed something sweet. Her pressure rose despite medication. Her urine started leaking protein. She feared a lifetime of bland meals and gave up salt in a single dramatic sweep, lasted a week, and then swung back. This time she chooses precision, not punishment. She brings breakfast back with protein and fiber, adds a 10-minute stroll after each meal, shifts to a low-sodium version of her favorite staples and seasons boldly with garlic, lemon, pepper, and fresh herbs. Her clinician adds a kidney protective medicine, and they agree on how to monitor. 2 months later, her urine protein drops, her energy steadies, and she discovers she still loves to cook because the food tastes like food, not like a lecture. Third, Alma, 76, small and spry, quietly losing muscle because she believed eating protein would overwork her kidneys. She ate very little, felt weak on stairs, and watched her pressure creep. A dietitian explains that starving muscle worsens insulin resistance and adds to the pressure problem. Her kidneys don't need less nutrition. They need steadier, smarter nutrition. Alma brings protein back sensibly, never bodybuilder amounts, always in balance, and pairs it with tiny leg strength moves she can do at the counter. Her kidneys are not forced to filter mountains of waste. They're protected by steadier sugar, stronger legs, and lower pressure. Her filtration number stabilizes. The best part to her is not the lab. It's that she feels safe on her stairs again. You might be wondering how to turn all of this into a day you can actually do. Here's a simple scaffold you can start tomorrow. Wake up and sit quietly for 5 minutes. Take your blood pressure, seated, back supported, feet on the floor, arm at heart level. 2 readings, 1 minute apart. Average them. If you don't own a validated cuff, make that your next small purchase. Think of it as a window into your kidney's day. Eat a breakfast that speaks softly to your vessels and your sugar. Choose one of the protein-centered options you enjoy. Take your medicine at the time you will never miss. Mid-morning, do your wall sit and hand squeeze sequence while the kettle warms. At lunch and dinner, build the calm plate. Flavor boldly with herbs and citrus. Keep sodium reasonable. After meals, stroll 10 minutes. Inside your home is fine if the weather argues. In the afternoon, take 5 minutes for slow breathing. In the evening, finish dinner 3 hours before bed if reflux or nighttime pressure surges bother you. Elevate the head of your bed slightly if late-night congestion or cough gets in the way. Hydrate sensibly. On days you feel unwell with vomiting or diarrhea, follow your sick day rules and call your team if you're unsure. If pain flares, reach first for topical gel and heat ice, and have a plan for short, carefully timed NSAID use only if your clinician approves. This is not a program you try. It's a rhythm you can repeat because kidneys respond to consistent, boring excellence more than to dramatic sprints. A few quick myths to put down before they trip you. Drinking lots of water flushes toxins. No, flooding can strain kidneys. Steady hydration is kinder. If it's sold over the counter, it's safe for my heart and kidneys. No, several everyday drugs raise pressure and pinch kidney blood flow. Safety depends on your situation. Salt is evil. I must remove it completely. No, salt is a tool. The goal is to reduce excess sodium, not erase enjoyment. Once filtration drops, nothing helps. No, flattening the slope of decline is a huge win, and people do it every day with the routine you just read. I can't do much at my age. No, arteries and kidneys still listen to better signals at 60, 70, 80, and beyond. If you like one line you can carry in your pocket, make it this. After 60, the worst poison for your kidneys is silent, relentless blood pressure. And you can neutralize it with short vessel training sessions, smarter salt and flavor, calm plates and post-meal walks, medicines taken like a promise, a sick day plan, and pain strategies that don't squeeze your filters. That sentence is your map. Your next step is small and immediate. Pick one change you will make before tonight. Set out a softball by the wall to remind you of your routine. Move your pressure pill to the time you never miss. Swap one salty staple for its low-sodium twin. Print your sick day rules and tape them inside a cabinet, or place your cuff where you sit for coffee and write the first numbers in a notebook. Tell someone you trust which step you chose. Ask them to check in with you next week. And if you know someone who jokes that kidneys are a lost cause at our age, share this message as an invitation, not a scolding. Your kidneys are not delicate glass. They are living tissue still responding to better signals. Give them a calmer world to work in, and they will do what they have always done for you. Quietly, tirelessly, without applause. Keep the rest of you alive and well.